Obviously, we're part of the healthcare professions, right? And so we have to be part of that solution.
WRAL investigates a new front to tackle the opioid epidemic, and this one involves pet doctors. From vet shopping for pills to people actually harming animals to get the drugs, veterinarians in North Carolina are now a part of the opioid epidemic.
Next month, vets across North Carolina will be required to submit information to a statewide database used to track opioid prescriptions. WRAL investigates. Cullen Browder is live in Cary now to explain changes for vets and pet owners. Cullen?
Well, Deborah and David, let's start with the big picture. In 2017, healthcare providers wrote 72 opioid prescriptions for every 100 people in North Carolina. That is well above the national average. What does that have to do with pets like this? Well, if you consider those statistics, they don't account for all those opioids that are meant for pets like this. That is about to change.
Hello, my handsome.
Dr. Jennifer Schultz's love of animals and science drew her to the veterinary profession.
Hold still. Good boy.
But starting June 3rd, she and her colleagues will start playing a role in a human health problem by tracking who's getting opioids and from where.
I think the reporting is needed. We need the data to know, can we identify those people that might be drug shopping at veterinarians?
Why? Because of cases around the country where pet owners are desperate to get drugs for themselves.
A gentleman that taught his dog to actually cough on cue so he could obtain hydrocodone-containing cough syrup.
North Carolina Veterinary Health Program CEO Dr. Joe Jordan also cites the case of a Kentucky woman who cut her own dog multiple times to get opioids. She was eventually convicted of animal torture and illegally obtaining drugs.
People thinking with an addicted brain are thinking with an ill brain, and they will do things, say things, and be things that they never thought they would be.
North Carolina is joining more than a dozen other states where veterinarians must use an electronic database to submit prescriptions.
This is a wholesale health crisis that we need to address in any way possible.
And if giving them some more data on really, are veterinarians a tiny drop in this big bucket, or are we more of a problem than we realize?
A 10-year study at the Pennsylvania Vet School showed opioid prescriptions on an upward trend in the animal world. They rose 41% each year, while the number of patients only increased 14%.
But I think it's very difficult to tell without some type of tracking just how big an issue this is.
There's a few people that we've suspected, the people that come in and are asking for opioids by name for their dog. If we have a suspicion, then we either don't dispense that opioid or maybe we give the animal an injection to get them through to the next morning.
While she supports better tracking, Dr. Schultz points out adding vets to the mix comes with consequences.
Veterinarians are kind of reeling at this point.
Electronic animal medical records aren't as compatible with the drug database as most human records.
Some of our members are seeing it takes 10 or 15 minutes to manually input one prescription into the CSRS.
Pet owners will also see a change. Vets will now ask for your date of birth when dispensing potent painkillers. Until it's quicker to submit information into the database, owners may face another stop on the way home.
I think that you're going to see some veterinarians who choose to write more prescriptions to a pharmacy than fill it in-house.
I've been working in this field for 30 years. It's all I've ever done. I've never seen anything like this. And I think we've got a lot more work to do.
Adding animal doctors to the effort to better protect humans from deadly addiction.
It'll be an adjustment for all of us, but I think it's a reasonable thing to try to be part of that solution.
Now, at least 2 states now require vets to do checks on prescription records for pet owners. In this state, that is not going to be the case. It's not part of this initiative. However, if your opioid prescription for your pet goes through a pharmacy, the pharmacist can do a history check on the prescription history of a pet owner. But it's not necessarily going to happen unless they have suspicion of abuse. Deborah.
Well, you know, those of us who love our pets just can't believe that people go to this extreme, but it's good to know that people are looking out for this. Cullen Browder, live in Cary with Atticus. Thank you.